All right, so Mark, a pump is slow. Pressure bag and push pull are probably really not much better. You know, when I get to the hospital, they've got the big rapid infuser sitting over the corner.
Right.
Why not just go to those?
Yeah. So they work well. Those things were, I believe, designed years ago for massive transfusion in an intraoperative setting, liver transplant and other things. And they work great, provide a lot of warmed blood products quickly. Some will run as fast as 999 per minute, a liter per minute. But they require a large bore access, often a sheath introducer. We call it a cordis. Mm-hmm. That's a sheath introducer, a big 8 French catheter that we put in a central vein, or a big bore IV, let's say a 14 gauge or something big. They'll work in smaller ones, but they are optimal in bigger gauge IVs. And then you can kind of set it and forget it. You can say, I want that 500 mils a minute to go in and restore that patient's perfusion. That can work. The problem is, one, they're kind of complex. It takes the right nurse to remember how to set it up and do it well. And if he or she's not there, sometimes we struggle to figure out how to use the machine.
Yeah, that's at least 10 minutes for somebody to set it up. You're right.
And then access is not always that easy to get. The patient arrives, the ER resident or surgical resident is going to put in a central line. How long does that practically take? It sometimes takes a while. It's not a minute. It may be 15, maybe faster. What if the patient only has an IO? It's not going to work at all.
Right.
And so what if we need to jump over to the CT scanner? Can we take that big machine with us? No. Did you have it on your aircraft?
Absolutely not. Pressure bag's best we had.
Do our EMS crews have them on their ambulances?
Good point.
Do we have it in the ICU? No. Do many smaller hospitals own and or know how to use a big rapid infuser? No. So in the right setting, with the right access, in the right hands, it can work effectively as long as it's titrated well. You can also over-resuscitate with those machines. But it's not a practical solution for the vast majority of environments where we encounter a patient in shock, want to give a fluid bolus, look at the response, and reverse that shock and hypotension quickly.
That's
so
a
great
point.
solution in the right environment.